Welcome back, everyone. For today's Ask the Expert, we're talking about pregnancy and various issues surrounding pregnancy. And joining me now is Dr. Margit Lister from McKay-Dee Hospital. And something trending, Dr. Lister, in birth control right now is the IUD. Is that something that doctors are recommending?
The IUD is an excellent form of birth control. It's as good as getting your tubes tied as far as efficacy goes, and it has a very low side effect profile, so it's actually a very wanted birth control right now.
Okay, so what about implanting an IUD? Is it more painful if you haven't given birth?
So if your uterus, if your cervix hasn't dilated with the birth of a pregnancy, sometimes it's a little more painful going in, and then sometimes it's more likely to be expelled. But they actually have a smaller IUD now for women that haven't given birth called the Skyla.
So you talk about efficacy. There's always incidents where people do get pregnant on birth control. Is the IUD form of birth control a way that women can also get pregnant? And if so, how would that work?
So everything fails. Getting your tubes tied fails, all forms of birth control fail, and sometimes the IUD does fail. And so if you get a positive pregnancy test with an IUD, the first thing we need to know is, A, where is your IUD? If it's still located in the uterus, then we need to remove the IUD. If it has fallen out, and that happens about 2 to 10% of the time, then it won't affect the pregnancy at all, and unfortunately, you got pregnant with an unwanted pregnancy. But as far as if the IUD is there and located inside the uterus and we can't pull it out, it does put your baby at risk for having complications with the pregnancy, early labor, an infection, and sometimes bleeding.
Very quickly, I think a lot of women, if they're done with their family and they're done having children, this is a great option. What about women who just want, you know, a 1-year reprieve from being pregnant? Is this a good option for them, IUDs?
It's an effective form of birth control. I think with the Accountable Care Act, birth control is a little bit more affordable, so I still think it's a good option. But if you're doing a short-term, looking for short-term options, sometimes you can find something that's a little, you can stop it. Like, you always have to come to my office and I have to remove it in order to stop it.
Thank you so much for the information. We do have a staff of volunteers here to take your calls, so call the number on your screen. And Mark, back to you.